This scenario is related to patient with neck pain when they do sit-up exercise or when they go out of the bed every morning. The patient might be doing the neck flexion movement using the global mobilizers, and here specifically we are talking about the scalene and the sternocleidomastoid. So here is what you're gonna see. The patient is gonna go with some protrusion every time he uses his global mobilizers. So again, the patient might be going into this way, moving the upper cervical spine into protrusion or chin out. This might be one of the reasons or things related to the problem. So here is what you are going to ask your patient to do in order to maintain doing the function, but with less or no symptoms. Number one, just not activating the deep neck flexors, which is one of the global stabilizer responsible for bending the neck forward. And number two, move the lower neck and thoracic spine up together, adding more activation to the global stabilizer, which is the deep neck flexor. So again, let's go from the beginning. Relax. Number one, just nod. Number two, move your neck up along with your ribs sinking down thoracic spine. And if this is given the patient 0 or less symptoms, you can use it as a retraining or as a movement modification.